Did you know that every year 1,270 people get paralyzed in the UK due to spinal cord injury, with the most occurring from car crashes and falls? There is no cure for spinal cord injury, and it leaves a person having difficulty with moving and feeling sensations below the level of the injury, drastically changing one's lifestyle, daily activities, and independence, with most bound to a wheelchair. People with spinal cord injury have pointed to an important aspect to improve their quality of life. That is the torso or trunk, which is the central part of your body, including your chest, back, abdomen and shoulders. The trunk helps maintaining balance, sitting upright, leaning and reaching, which are all needed during daily activities such as grabbing objects, cooking, doing the dishes, grocery shopping and carrying out your morning routine. However, rehabilitation of the trunk is rather complex and inconvenient. It requires people to travel to the hospital and are dependent on physiotherapists who have limited time per patient. Therefore, we are looking to improve trunk function in more effective ways. We are Dr Chiou and Joeri van Helden from University of Birmingham, and we are looking at an arm cycling exercise as a way to improve trunk function in people with spinal cord injury. We do that in collaboration with our colleagues, Dr. Deborah Falla and Dr. Eduardo Martinez Baldes, both affiliated with the Center of Precision Rehabilitation for Spinal Pain, and Dr. Paul Strutton, head of Nick Davey Neurophysiology Lab at Imperial College London. So why arm cycling? To answer that question, we first have to look at the human anatomy. The brain controls all movements we want to make and does so by sending signals that travel along so-called corticospinal tracts in the spinal cord to the muscles in your body and from the muscles back to the brain. However, these connections have been damaged in people with spinal cord injury, so not all signals from the brain reach the muscles and not all signals from the muscles reach the brain. This compromises using muscles below the level of injury, making it difficult to move the body and carrying out daily activities. Recent work of Dr. Chiou has shown that a single 30-minute arm cycling session can make these connections from the brain to the trunk more active. We are therefore starting an 8-week intervention with people with spinal cord injury who will arm cycle almost daily from their own home. Before, during and after the intervention, we will carry out several tests in our laboratory at University of Birmingham to understand changes in the body induced by arm exercise. We perform functional tasks such as reaching and leaning forward, and we also assess communication between the brain and the trunk using transcranial magnetic stimulation. This is a painless method that activates part of the brain that then sends down signals to the trunk. To activate the brain, we use a coil that is placed on a person's head while simultaneously recording signals in the trunk. By doing this research, we hope to provide new ways for trunk rehabilitation in people with spinal cord injury that are easily accessible and cost-effective. Do you want to reach out to us, or do you have any questions about our research? Feel free to send an email to Chloe at s.chiou@bham.ac.uk or Joeri at jfv007@student.bham.ac.uk and follow our research on Twitter. Our research is funded by the Inspire Foundation and is carried out at University of Birmingham in partnership with the Midland Centre for Spinal Injuries at the Robert Jones and Agnes Hunt Orthopedic Hospital NHS Foundation Trust and the National Spinal Injury Centre at Stoke Mandeville Hospital. Thank you for listening and have a great day.